Hi Jessica, my name is Jolene and I'm going to be your nurse for today. And I'm going to do a quick postpartum assessment on you. Is that okay?
Yes.
Okay, perfect. So I'm just going to perform some hand hygiene and I'm going to make sure that I have some privacy with the curtain closed. Could you please verify your name and date of birth for me?
Jessica Hart, 1488.
Okay. And could you tell me if you have any allergies?
Penicillin.
Penicillin, okay. I'll go ahead and make sure that that is noted in your records. So before I begin, I'm just going to take a quick set of vitals. I'm going to listen to your heart sounds, your lung sounds, and also check your bowel sounds, okay? All right. You could take a deep breath. Then I'll listen to your bowel sounds. Perfect. Okay, so your heart sounds are good. Rate is normal, rhythm is normal, and your lung sounds are clear. And I do hear bowel sounds in all 4 quadrants, so that's perfectly normal. Okay?
Okay.
So first I'm going to begin by checking one side of your breast by exposing only one side at a time, and I'm just going to feel around the breast and it feels soft to me. I'm looking at the nipple and the nipple does not look cracked. There's no redness and they are not inverted. Do you have any pain in either of your breasts?
No.
No, okay. Same thing on this side, exposing one side at a time. I just feel the breast gently and I'm noting that it feels soft. The nipple is not inverted. There is no redness and no cracking. And then Jessica, I just wanted to mention that the next time that you're nursing the baby, maybe you could give one of the nurses a call just so we can make sure that the baby is latching correctly, okay? All right.
Okay.
So then I'm gonna move down and then I'm going to check the fundus. So while I'm doing that, I'm just going to put my hand here gently at the bottom, and then with this hand, I'm going to feel around on the fundus and make sure that it is firm and not boggy. I also wanna make sure that the fundus is midline, and it is about 1 finger breadth under the umbilicus, which is good because she just delivered yesterday. Jessica, when was the last time that you urinated?
30 minutes ago.
About 30 minutes ago?
Yes.
All right. So another thing that I'm looking for is to make sure that the fundus, if it were to either side, maybe that would tell me that she needed to empty her bladder, which is important to do for the fundus to go back to shape and no bleeding would occur. Extra bleeding would occur, hemorrhaging. Also, when was the last time that you had a bowel movement?
Yesterday.
Yesterday. All right. Okay. So after I check the fundus and everything looks good, the next thing I'm going to do is check for the lochia. And I'm looking at her pad, and the pad has some small to moderate amount of lochia. The color is rubra, and I do not notice any odor. The next thing I'm going to be checking is for an episiotomy, and she does have one. So I'm going to be checking for redness, edema, ecchymosis, which is any bruising or redness or discoloration, drainage. There's no drainage and the edges of the episiotomy are approximated. While I'm also checking for an episiotomy, while I'm down here in the same area, I could be checking for any hemorrhoids that may be happening, but I do not see any, so that is just perfectly fine. So then I'm going to cover up my patient and move down. And the next thing I'm going to be checking for is the Homan sign or any blood clots in the legs. So I'm going to be carefully checking the legs and checking for any edema, swelling, any warmth or redness. And I'm going to ask if you have any pain in either of your legs.
No.
No, okay, so that tells me that there's no blood clots occurring in the legs. The next thing that I'm going to be confirming with the patient is also that the mother is immune to rubella, which she is, and whether or not she needs a RhoGAM shot. And I would be checking to see if the mother is Rh negative and the baby is also Rh negative, therefore no shot is needed. And that would complete my postpartum assessment.